Hello, this is Dr. Benko Machiri, and so for today's video I'll be talking to you about surgical management. That is from when you're being received by the surgeon to when you're being operated, right up to your discharge and eventual follow-up, or what we call rendezvous. It's extremely important for patients to understand what surgical management is, because when you're going to the hospital you should know what is expected of you and what the requirements are. So in surgical management, it's all about the time from which you're received by the surgeon. When he does his examination on you, he requests for the workup laboratory test, he admits you for and plans you for surgery, and when you actually do the surgery, when you're taken back to the ward for follow-up, and then eventual discharge and follow-up. So surgical management can be divided into three topics, or three like separate sections, and this is preoperative care, operative care, also known as intraoperative care, and postoperative care. And I'll just give you a summary of how these three groups of these three steps are. The first is preoperative care. That is from the time when you're referred to the surgeon, or from the time that the surgeon receives you, examines you, asks for your workup. It could be a blood test, it could be imaging, it could be ultrasound, it could be a lot of other things. From when he makes his diagnosis to when he admits you, and he requests for what we call an admission workup. That is, he might check your liver function test, he might do a lot of other examinations preparing you for the surgery. So this is the preoperative care. And in the intraoperative care, or in the operative care, it has to deal with the day of operation, what operation is done, and your immediate recovery from anesthesia. This section falls on what we call intraoperative care. And the postoperative care has to do with you being in the ward after your operation. That is, the surgeons or the doctors will follow your progress and evaluate if you are healthy enough to be discharged. And after your discharge, they will program you, or they will plan for a follow-up, which could be a 1 week follow-up, a 2 weeks follow-up, a 1 month follow-up, depending on the surgical specialty, and also depending on the procedure that was done on you. And so these three steps in the surgical management of patients is extremely important, because each step has a direct impact in the surgical outcome of the patient, that is, in the prognosis of the patient. And so patients are advised to know these various steps, because a problem in each of these steps could affect your procedure. So today we have learned about surgical management, which could be divided into three parts: preoperative management, intraoperative management or operative management, and postoperative management. So in my subsequent videos, I'll be going a bit detailed in the various steps in surgical management. Thank you, and waiting to see you in my next video.